First at 5, demand for testing is spiking in Bexar County now that the holidays are over. This was the line that was snaking along the test site on Rigsby in East San Antonio early this morning. Most residents told us they waited for 3 hours before getting a test. Across Texas, we are seeing a spike in cases. Today, the state announced more than 51,000 new cases. Even with the new wave in COVID cases nationwide, the CDC has cut down its isolation guidelines from 10 days to just 5 days, with no testing requirement to return to work. Health experts say the transmission phase of the Omicron variant happens 2 days before someone shows symptoms and 3 days after. But with testing availability in short supply, should you get a test before returning to normal activities? We sent Eyewitness News reporter Vanessa Croy to the experts for answers.
The rise in Omicron cases prompting the CDC to lower the days of isolation or quarantine to 5 days from 10.
The time from exposure to the time of onset of symptoms is much quicker with Omicron. Usually people are getting sick within 2 days.
Dr. David Good is the chief operating officer for Texas Med Clinic. He says the strain develops faster and people are able to get rid of the infection more quickly, cutting down the time they can pass along the virus to others. But the new changes are sparking some confusion, with no way of confirming positive cases are actually the Omicron variant.
You could have had Delta, or you could be the test case for a brand new virus. We don't know.
Plus, the Omicron variant tends to show milder symptoms. Many could be mistaking for allergies.
I personally, as a practicing physician, don't think it's really possible in most cases to tell that it is Cedar and not Omicron. Or we're also starting to see flu cases. So we have 3 things circulating around out there that all look similar. I think you just have to assume the worst, that you have COVID under the circumstances, and either isolate or quarantine as per the guidelines.
Yesterday, Dr. Anthony Fauci said the CDC is facing some backlash over the new guidelines.
About why we don't ask people at that 5-day period to get tested.
But Dr. Good thinks that could soon change.
I believe the CDC recommendations are going to be that you have a test, a rapid antigen test at 5 days.
But finding a test may present another challenge.
Today, my answer would be you should test at 5 days. Unfortunately, I know that to be an impractical recommendation because you would have a hard time, I believe, finding a test in San Antonio today, if today was your 5th day.
Metro Health is offering pop-up testing sites, but lines are long. Other clinics across the city also overwhelmed and short-staffed.
We're seeing our own issue here, as every health organization is. We have about almost 10% of our staff out, this week with COVID. And unfortunately, that's starting to impact the number of tests we can do.
Dr. Jan Patterson with UT Health says it's still not too late to get your vaccine or your booster, which can only help.
We're seeing that boosted does give you significant protection against Omicron.
Vanessa Croy, KENS 5, Eyewitness News.